So then next speaker it's my pleasure to introduce Dr. Marianna Vitaloni, which she is the medical and scientific project manager at the Digestive Cancers Europe in Brussels. So Dr. Marianna holds a PhD in genetic and human pathology with experience in biomedical research work in regenerative medicine. And actually, she has pivoted to patient advocacy and the scientific project coordination in digestive cancers. She works there to connect scientific research, patients' perspective, and global health initiatives with a strong focus on GI cancers, gastrointestinal cancers. So, Dr. Marianna, we are looking forward to your presentation. The virtual floor is yours.
Thank you for the nice introduction. So good afternoon, everyone. Thank you for the nice introduction again. It's my pleasure to be here. As you said, I'm Marianna. I work for Digestive Cancer Europe, and today I will be happy to share how at DICE we put patient co-creation into practice for gastrointestinal cancer research through real example from European projects we are involved in. So I don't have any conflict to declare. And just briefly, Digestive Cancer Europe is the European umbrella organization representing patient groups affected by digestive cancers. Our mission is simple: fewer people impacted by digestive cancer and better outcomes for all. And our vision is equal access to prevention, early diagnosis, and high-quality care across Europe. And we act through advocacy, research, awareness, and of course, co-creation. We cover all major GI cancer from colorectal to gastric, esophageal, liver, pancreatic, and rare digestive cancers. What do we mean by patient co-creation? When we talk about patient co-creation, we refer to an approach that values patient engagement into the design, development, and delivery of solutions for patients' use. Maybe I'm repeating a little bit what the previous speakers already said, but for us, it's really important to stress that it's about continuous collaboration across all research stages. It builds trust and shared ownership between patient and researchers, and importantly, is not a box-ticking exercise, but a true partnership that improves both scientific and social outcomes. And I'm saying this last point because sometimes some researchers or some physicians reach out to us like 1 week before the deadline for a big submission of a project, and they want us to invent some tasks to include in the project. So we really try to communicate that it's important for us to involve the patient perspective since the beginning of the design of the project. So why does it matter? For clinician and researcher, it improves the relevance and quality of studies, boosts recruitment and retention, and strengthens trust in science. For patients, also there are benefits. It ensures clearer information, tailored communication, and genuine sense of empowerment and inclusion. Here I'm also sharing some evidence that support this, as someone before asked about evidence. So, of course, as the previous speakers already mentioned, there are barriers for the implementation of patient co-creation. First of all, the traditional hierarchical culture of medicine, where decisions are often top-down. Second of all, limited literacy and time availability among patients. Third, the lack of structure feedback mechanism, meaning patient input is often collected but not reused. And finally, tokenism, the involvement for appearance rather than for impact, and the difficulty of measuring real change. So it's important to recognize this barrier because it's the first step toward overcoming them. So at DICE, we have developed several strategies to make co-creation real and sustainable. We run focus group to collect patient insight and select relevant outcomes. We set up patient advisory boards and committees for continuous input. We conduct surveys and feedback analysis to evaluate experiences. We produce educational toolkits and visual to explain complex science. And we ensure transparent dissemination so that patients always see how their feedback has been used. And of course, all these strategies that I mentioned can be adapted to every kind of organization, research center, and to every kind of project. So now just a quick overview of the project we are involved in. So as you can see, we are currently involved in several EU-funded projects under different programs. And I would like to showcase some of the example of using co-creation in this kind of projects. So the first one, it's a project called TOGAS. This is the EU-funded project that aimed to design the first European guidelines for gastric cancer screening. It's a big consortium. We are 19 partners, and DICE coordinated a large survey across 19 countries. We reached about 20,000 respondents, and we also, as a co-creation exercise, conducted survey among pilot study participants, as TOGA is organized around pilot studies to understand which is the best strategy for future gastric cancer screening in Europe. Through these two exercises of co-creation, we identify barriers and motivators that may influence participation in gastric cancer screening in the future. We also co-developed 3 educational booklets for participants in the pilot study to explain them the process and the benefit of screening. And these insights overall are now being used to inform future European guidelines on gastric cancer screening. The second example is Sagittarius, another Horizon Europe project focusing on ctDNA to guide adjuvant therapy decision in colon cancer. This is a clinical trial, and our role at DICE was to make sure that the patient voice shaped every step. So for Sagittarius, we organize a patient focus group to select the meaningful patient-reported outcomes to be used during the clinical trial. We help simplify consent form and patient information sheet. And we co-created infographic, educational material, and dynamic website explaining the role of ctDNA in treatment decision. And another important point in this project was that as the clinical trial is run in Spain, Italy, and Germany, we always make sure that all the materials are translated at the national languages so that everything is more accessible for patients. So what we expect from all these activities to lead to a better understanding and engagement throughout the study for clinical trial participants. And then I would like also to present a third example. It's another project called Guide MRD. It's a people-centered precision oncology project designed to improve the utility and clinical implementation of ctDNA in colorectal, pancreatic, and lung cancer. And in this project, together with other patient organizations, we participate in the creation of a patient advisory board to understand patient needs and experiences along the care pathway. And the patient advisory board has been involved across the entire process of research and development since the very beginning of the project. And then also, I wanted to share these references to show that what we do at DICE is not just something that we invented, but there is literature behind our activities, and this literature is supporting what co-creation is and how this co-creation process and exercise can really improve the final outcomes of every research activity. From all these experiences, a few key lessons. So first of all, involve patients early, ideally before a project even is funded, is fundamental. Provide training for both patients and researchers is also key, because if from one side patients maybe needs to understand the science behind the project, also researchers need to understand how to communicate and to work with patients. Use plain language and visual tool to simplify science is always very useful. Keep feedback loops open throughout the research life cycle helps to improve the process, and always value patients' time and expertise as equal contributor. As the previous speaker was saying, it is important to value the time and the experience of patients involved in the projects, and we really always try to, you know, to make sure that in each project there is a budget for the patients that are supporting our activities. Okay, and looking ahead for DICE, our priorities are clear: to strengthen collaboration with the EU researchers institution to promote the co-creation process, to embed co-creation in all our research projects and activities, to advocate for PPI, patient and public involvement coordinators, and dedicated funding for patient engagement, and to continue building evidence to measure the impact of co-creation on research quality and patient outcomes. Oops. Okay. To conclude, so co-creation is not a trend, it's the foundation of meaningful and impactful cancer research. By working with patients rather than for them, we make research more relevant, equitable, and effective for everyone involved. And this is a photo of our annual event. We call it Masterclass, and it's a 3-year come together with all our member organizations to inform them, to share experiences, and to stay together and discuss what next for GI cancer. So thank you very much, and feel free to contact me if you have any question, and I will be happy also to share my slide with you.